All right, welcome to Beyond Scrubs, Dr. Kel Nesbit. I appreciate you taking time out of your day to join me on the podcast today. Do you mind giving me or giving us an introduction of yourself?
Sure. My name's Kel. I'm a PGY3 in anesthesia, so CA2. Um, what else do you want to know?
That's a good brief one to start with, and then we'll get to know you a little bit more on the podcast for sure. So, talk to me a little bit about what made you decide to go into the medical career route.
I mean, kind of just cliche, like a lot of other people. Just wanted to ever since I was a little kid. I always thought it would be cool to be a doctor. Subjects I was best at was science, and I never really wanted to do anything else that I can remember easily anyway.
Gotcha, gotcha. So, if you had to pick another career path in college, right? If you can remember back to your college days, what would it be and why? If not medicine, I know that you've kind of as a kid you always wanted to be a physician, but let's say you didn't choose to be a physician, what would you have chosen?
I probably would have done something with computer science. That's one of my hobbies I really enjoy and that I'm good at. So probably if I didn't do medicine, I probably would have tried to do a major in computer engineering or something like that, computer science.
Gotcha, gotcha. So talk to me a little bit about, you said that you've always wanted to be a physician as a child. Do you feel as though, is that a necessity to, do the medical career, or do you feel as though, you know, um, that doesn't matter as much, if you wanted to be when you decided early on in life or later in life, do you think it matters much?
No, I mean there were a lot of people in my med school class that decided late or had another career first. I mean there was a lady that was like 55 when she started as a MS1. And then one of my best buddies was a nuclear engineer for years, and
Dang.
then he decided to be a doctor after that. He's my PCP now.
Gotcha, gotcha, gotcha. Um, so any kind of piece of advice do you have for pre-med students kind of working their way through college right now, trying to pursue a career in medicine?
Um, I mean, it's definitely getting harder and harder because the well, more so for residency spots, but the number of med schools has increased and the class size have increased, but the number of residency spots has not kept up at all. My understanding is part of that is due to a freeze on new residency starting, like for the last 20 years or something. And it's since residencies are funded through Medicare, it's there's a lot of bureaucratic red tape to increase the number of spots in a given residency. I mean, ours was trying because ours is small and we were trying to add another spot, and God knows we have more than enough cases for
Yeah,
more, but the I guess we couldn't get funding or approval or something for another spot just because of some, you know, bureaucratic BS. But
yeah,
so it's definitely getting if you want to, I think if you want to do something competitive, um, it's just gotten harder and harder. I got lucky and got into anesthesia, kind of right at the beginning of the recent surge, and now it's anesthesia's had a lower match rate than ortho, which is crazy, this past year. So I know for anesthesia specifically, and like you, ENT, all the competitive ones, it's getting very hard to match those.
for sure, for sure. Well, talk to me a little bit about, you've talked about kind of, some, I would say, I guess, controversial things, or I would say more hot topics of, why we're having kind of physician shortage, of course, and that can be based off of there's multiple tiers of that, right? How many medical schools there are, and then from there, how many residency spots there are, right? And then of course, that doesn't even get into other physicians from other countries coming over too to try to apply for residency spots. But talk to me kind of a little bit about you talk about how hard it is to match into residency in general nowadays, right? It doesn't even matter a specialty, there's just a lack of spots. Do you feel as though if you're a pre-med student looking at medical schools, do you feel as though the brand name of your medical school plays a role in, the rest of your career, or doesn't play as much of a role as you think?
For me, it didn't at all. But the caveat there is that was back when step one was scored.
Sure.
Um, because at least to my understanding, that was always the way for, like, I went to Texas Tech, so that's not like Harvard or anything, but if you score well on your step one, they're going to take somebody who has a higher step one from a quote unquote less prestigious place. Um, I know they're focusing on step two, and that's still scored. That's good. But what I would worry about in the future is if they make all these exams pass fail, then they're just going to default take the kid from Harvard, which, is
Sure.
understandable. Like, you can't really blame the programs for that if they have no other way to delineate the caliber of student. They're going to take the kid that went to a more prestigious place. Um, Hopefully it'll stay with a scored big exam like that so that no matter where you go, you have a shot. But that's definitely something that concerns me about the future, even though it won't affect me. But yeah.
Yeah. Yeah, no, no, for sure. I think you hit it right on the nail there. With things becoming pass fail, there's always pros and cons, right? I think schools are trying to make things less quote unquote stressful, right? With mental health and
Wrong
things like
career for that.
yeah, yeah, for sure, for sure. But at the same time, kind of what you said is going to schools that are not brand names. The John Hopkins, the Harvards, the Princetons, things like that, right? Then of course, standardized tests are meant to equalize a playing field. And so the more that we get away from scoring things, the more the way that we become, as long as you participate and work hard, you get through it, then, when we're applying for these residency spots, the con of that is now, the default is, okay, well, now all that matters is kind of, where you went to school, right? So, going to be a big issue in the future if we keep doing that.
Yeah, I'm really hoping they keep the scoring around. And you're right. It does suck to have your entire future based on one test, and everybody has a bad day, or maybe somebody's a bad test taker. And really, I don't think, unless you like do really, really bad on it, I don't think it has any bearing on how good of a resident you are.
Yeah.
Um, but there has to be some objective metric that you can separate yourself. Um, yeah.
Yeah, no, for sure. And it is stressful for sure, but at least in my perspective, it gave me kind of that opportunity, especially I went to Texas Tech too, as you already know, Kel.
Hmm.
But yeah, in our minds, we're all type A personality, regardless of what medical school we went to. So in my mind, when I took that test, I was like, well, I have to show, people that I'm just as good as a guy that went to Harvard or Princeton, right? And the more that we get away from that, now it's going to be, regardless of what you do, you're never going to match up, right? Which is going to be a pain in the butt later on in the future. So,
And from what I heard, granted, I haven't, looked up the stats myself, but from what I've heard from a few people is the pass rate in step one has decreased since they made it pass fail. Um, what I would guess is because people aren't studying as hard for it because they know it's pass fail. And the problem with that is that it's just kicking the can down the road because now that step one's pass fail, they're putting more step one material in step two. Um, and then people are going to do worse on step two if they didn't study hard for step one. Um, and that chases you down your ITEs during residency because you'll still have basic physiology stuff on those exams as well. So yeah, I think that was an unintended consequence.
for sure, for sure. As you already know, part of what I do is I still tutor and whatnot. I've been doing it for years. And so 100%, the pass rate has gone down. And a lot of it deals with, the mentality of it, right? When everything becomes pass fail, we're all human, right? If you told me it's pass fail, right? How much am I going to, on an effort standpoint, how hard am I going to try compared to when there's a numeric score that tells you exactly how hard you tried, right? So yeah, the motivation is not as high as it was before when step one was scored. You took it scored like I did, right? And so I remember that test was like everything, right?
Oh
Even
yeah,
compared to step two. If you did not do well, good luck, right? There's
yep,
nothing, there's nothing else that they're gonna look at that score and be like, well, I guess you got to do something else, right? And so, yeah, that kind of urgency is no longer there for step one, I would say, because of its pass fail, and of course, more people are failing. So
I mean, like it or not, human beings are incentive based, so you have to have an incentive for things.
yeah,
Yeah. I mean, the other good thing about having the step one being scored is you could say you did badly. Well, then you have 2 more years of medical school to say, okay, I need to, like, I'm not going to match into neurosurgery anymore. Okay, let me find something else I like. And then you can fall in love with another specialty that you have a good chance of matching into. And then, it's not like heartbreaking when you show up for residency match and don't match into something because you've already, kind of accepted that it's not going to happen. You're happy with your second best choice or whatever.
Yeah, yeah, for sure. And that's something that stuck with me. That what you just said is kind of that whole same motif or pattern of you're kind of kicking things down the road, right? Now everything is a year delayed, right? So I mean, I remember step one was like this huge filter, right? If you were like, oh, I'm doing something competitive, you don't do well or as well as you wanted to do, then you're like, okay, maybe I should do something else. Now that's going to be step two, and as you know, that's going to be really freaking late in your medical school career, right?
When
End
you
of your
don't have
third
time
year.
to do something else, you don't have time to get letters for something else, you know.
Yeah, for sure, for sure. That's difficult. So, kind of talking about the difficulties in medicine, since we're already on this topic. So, what do you feel as though created the most stress and anxiety in medical school for you personally?
Hmm, I don't know. I mean, it's easy just to say step one because that, like I'm sure you
Sure.
remember that was definitely the most stressful day of med school. I would say, I mean, not for me specifically, but a lot of my friends, the interview process was stressful. A lot of my friends did ortho and a couple other really competitive stuff, so I know they were, doing their away rotations and having to try really, really hard on those and being away from home. I know that was stressful for them. For me, it wasn't so bad because I wanted to stay here, and I
Yeah.
was pretty sure I had a good shot of staying here. Um, at Tech, so I wasn't as stressed during the interview season. But I know those aways and interviews were hard for a lot of people.
Gotcha. Gotcha. So, I know that, in medical school, in our medical profession, we don't talk about it too much, but do you ever feel like you or your classmates were ever stressed or I would not stress is not the right word, but depressed or dealt with kind of mental illness things in medical school? And if so, how are some outlets that they kind of dealt with it, or you in particular?
Um, I don't know. I've never really stressed too much, so and maybe that's a bad thing. I maybe should have stressed more, but I think I think when people get into trouble, it's not just because of med school, it's because of that combined with external factors, trouble at home, trouble with drugs and alcohol,
Sure.
unhealthy ways of coping, and combined with the stress of medicine.
Yeah.
Um, in a vacuum, I don't think like med school is definitely hard, and it's definitely harder than undergrad or high school or anything else, any other schooling that you would have done up until that point. But
Yeah.
in a vacuum, I don't think it's, so terrible that it's undoable. It's really the combination of factors is what gets people.
Gotcha. Gotcha. And how do you feel as though, you do, what is your outlet kind of for stress and anxiety relief? Is it spending time with your family? Is it, sports? What do you do to kind of relieve kind of some of that stuff in your life?
Yeah, I'm lucky. I have a very supportive wife. We were dating during med school and married in residency. Um, but I was lucky that she was also she's a speech path, so she was in the health profession, so she kind of understood um, how much studying it takes and me not having as much time and stuff like that. So that was a big help. I didn't feel like I ever had to sacrifice studying to spend time with her.
Yeah.
And, quite the opposite. It was very supportive. I played sports during med school until I got too many concussions and stopped that. So exercising, playing video games, spending time with my wife, my dog, um, all kind of normal stuff that people do.
Yeah, for
I
sure.
like
For
to,
sure.
hunt and fish. That probably my favorite thing to do to just disconnect is go hunting and turn my phone off and just be out in nature.
Awesome. Awesome. Yeah. Only reason why I ask is, sometimes those things get lost in medical school for sure. right? Not being normal. I know that it sounds real simple what it is, but you're grinding so hard, and the next thing you know, you're not exercising, you're not talking to people, right? You've isolated yourself. So yeah, it's important to do those normal hobbies, right? Family's important. Sports, if you play sports, or hobbies that you have, for sure will definitely help.
Yeah,
Um,
I mean, med school and residency is just like, the ultimate exercise and time management. I think there's enough time in the day for you to maintain your hobbies. It just, if you're not efficient, then you're going to sacrifice stuff outside of studying. But I think it's doable. And granted, I didn't go to Harvard, so they might, hammer them harder up there. But I felt that I got a very good education and still had time to do the rest of my stuff.
gotcha. So still sticking on the medical school kind of topic here. Did you feel like you had any, failures or bumps when you look back into your medical school, like while you're in a medical school? And if so, did that kind of influence how the kind of physician you are today?
Um, wouldn't say any like major setbacks. I mean, I took a gap year, so the first the first exam in med school in anatomy, I was pretty close to that 70% failure,
Yeah,
just because
yeah.
I hadn't studied in a year, and I was out of the habit and was not being efficient. Um, that scared me, and you know turned it around and got back to good studying habits. Other than that, I mean, Uh, I initially wanted to do urology, um, but realized I didn't like surgery during my surgery rotation. Turns out I like sitting down. Um,
Yeah.
and then my step one score was, it was good, but it wasn't high enough to where I'd be very confident I would match urology anyway. Although nowadays I probably wouldn't even match anesthesia. Um, but yeah, so kind of those two things together made me reevaluate and ended up spending some time with anesthesia because I was hating my surgery rotation. So on that rotation, I spent a week with anesthesia and really liked it, um, and realized it was what I wanted to do.
Gotcha. Well, you transitioned pretty nicely. My next question was going to ask you about anesthesia as a specialty, but going a little bit deeper into anesthesia, talk to me kind of with, you almost being done with residency, right? Getting close there. Talk to me kind of from what you know already, pros and cons about the specialty.
So it's the biggest con is anesthesia is basically always a deficit department. Um, Back whenever they restructured payments from the government or from insurances, it kind of changed to the hospital gets a lump sum for the surgery, and they're kind of including anesthesia in that lump sum. So the actual RVUs for anesthesia decreased. So basically, any hospital that I'm aware of, the anesthesia department has to receive basically stipend or subsidy from the hospital to keep the department afloat. Now, those nice big lump sums the hospital gets from the surgery are where the hospital makes all their money. So you need anesthesia. So there's always going to be a tension between, and this is any place I've ever heard of, there's always a tension between hospital and anesthesia because it's a deficit department. Now, if whether that's a healthy tension or not depends on the place. Um, but I would say that's kind of a major thing with anesthesia that people don't think about when going into it. But you just have to find a place where there's a good relationship and you know that and all the funny cliches about like, oh, blame anesthesia, it's always anesthesia's fault, every delay is anesthesia. Um, it takes you 2 minutes to intubate and then turn over to surgeon, and then they take 45 minutes to start the case, but it's still anesthesia's fault, you know?
Oh, I know. Yeah, anytime I have a slow day, I'm always looking at anesthesia like, golly, these guys, all they do is just sit down on their phones, man.
Yep,
For sure.
yep. Like
Um,
Glockenflicken said, the giant on-off button.
exactly. So talk to me, You talked a little bit about kind of on the business side of things of hospital anesthesia, and we're already on the topic. What is your perspective on back when I applied for ENT, but and during that cycle, everyone was there was a down kind of an anesthesia during that time due to the fact that people were worried about CRNAs or anesthesia assistants and things like that taking over jobs in the OR. What is your perspective on that, and kind of how do you think about that stuff?
I mean, I have a good relationship with all the CRNAs and CAAs. At least I think I do. I hope they agree. Um, as far as anesthesia jobs going away for MD anesthesiologists, I don't think that'll ever happen. I know people were worried about it a few years ago, but then when COVID happened and all the elective cases were canceled, all the older anesthesiologists retired. So there was a huge supply and demand mismatch, and all of a sudden anesthesiologists are doing really, really well, and everybody wants to go into it. So, I think people try to predict the future and worry about stuff like that. But as far as I'm concerned, I think there's always going to be a role for MD anesthesiologists as well as CRNAs and CAAs. Everybody is very important in the team care model, and I think everybody does an awesome job.
Gotcha, gotcha. And then, all right, so let's kind of move a little bit from kind of that topic and a little bit more about kind of your residency experience. Talk to me, as an MS4 about to finish up, school in a couple months here. What advice would you give them to prepare for intern year?
I think it depends on what your intern year is going to look like. For us, one of the good things about our program is the intern year was relatively not too bad as far as work hours. Um, Now that was nice. Having a nice intern year was awesome. The downside of that is then it's more of a shock when you start your anesthesia years. Um, since then they have changed it. I think it's been a positive change. I didn't go through it, so I can't necessarily speak to it. But our interns have said it's been really, really good. They're definitely working a little bit more than we did, but I think they're going to be better prepared for the anesthesia years. So if you're going into surgery and you're going to be a surgery intern, you're going to be working a lot. Um, it's going to be pretty brutal. Um, if you're going into, you know, like optho or derm, it's probably going to be a little easier. And that, of course, depends on where you are. But either way, I mean, people stress out a lot about starting intern year and how do I use the EMR? How do I put in orders? What if I don't know what to do? All that stuff. But I mean, you always have somebody above you, a senior resident, a fellow, an attending. They I think what people think they're expected to know everything when they start, but you have to remember that the person above you, whether that's an attending or a resident, they expect you to not know anything, and
Yeah.
that's normal. So I mean, you might get roasted more in some specialties than others for not knowing anything, but the default is everybody doesn't know anything, and everyone expects you to not know anything. So if you get roasted for it, it's okay. Just don't take it personally. It's just the nature of you know them trying to toughen you up.
Yeah, yeah, for sure. And yeah, I agree with you there. I mean, I expect my intern to know nothing coming in, right? And our attendings also expect that. And so, in a sense, right, even though you, as the intern, probably feel like a lot of pressure to know things and stuff like that, but actually, in reality, right, there's actually no stress as an intern because, like you said, there's always someone above you, always checking your work, etc. Right? The expectation is that you know nothing. Um, but yeah, so a lot of it is kind of that self anxiety and self stress when you start. But kind of on that same note, what are some common mistakes that you notice, interns make if you were to, especially an anesthesia intern, that you see
Um,
happen?
well, like I said, my intern year was different than it is now. I think one of the reasons it's better now is because as interns, they're working with some of the other departments that we interact a lot with, like OBGYN and surgery, which is great. I think it's awesome to build those relationships. And I mean, kind of as an aside, that's one of the things I love about our program is that it's small and you're friends with residents from all other departments like you and me.
Yeah,
So it brings those walls down in the OR when you're communicating with a friend that you just went to the
yeah,
bar with the other night,
yeah,
versus somebody you've never met before. So I think it's good that now they're working with other departments and building those relationships early. Um, I don't think any of our interns have made this mistake, but one mistake that would be easy to make would be to kind of burn bridges with those departments as an intern, because then they're not going to like you when you're doing the anesthesia.
Yeah, yeah, for sure. I mean,
I
on
mean,
a
the
broader
moral of the
note,
story, the best advice for residency is just be normal. Like,
yeah,
so
no, for sure.
just be
One,
normal.
yeah, for sure, for sure. I mean, and like you say, you're talking about these relationships that you have between, other specialties, and to me, I always extend this out to even nursing staff and things like that. And I like how you sum it up, just be normal. And for sure, like I think one of the biggest mistakes is, you're kind of a little bit, feeling yourself too much, meaning, you feel like you're a big shot, you're burning a bunch of bridges, etc. Right. And it just makes your life like so much harder, right?
Oh
Like you're
yeah.
already you're already getting roasted from, sometimes upper level, sometimes attendings, right, as you're learning. And then now you've added on to the roast by like other specialties, nursing staff, etc. Right. And so it just makes like life so much harder. So yeah, I mean, definitely for sure communication is key. And like you said, it's really a team kind of effort. We've moved away from, big shot physicians, trying to go solo, right? And so it's really kind of, talking with your anesthesia, talking with your surgeon, talking with your nurses, etc. And like you said, just being normal is going to make your life so much easier.
Yeah, the worst thing you can do is be rude to like the rest of the staff, whether that's other physicians or nurses or anesthesia techs or whatever. I mean, most of these people have been, even though you're a doctor or whatever, they've been doing it for 20 years and they know more than you. They may not necessarily know more of the book learning, the physiology, the stuff you learn in medical school. You may know more than that, more than them in that department, but they have practical knowledge of the last 20 years they've been doing it, or 10 years or whatever, more than you. That's the point, more than you.
Yeah. Yeah.
Um, so, I feel like it was very helpful to ask their opinions on things. Whenever, especially when I was a CA1, I would try to, ask the PACU nurses, like, hey, how did the last patient do? Is there anything you would suggest I change about my anesthetics so they, do better in PACU? And then doing a month just sitting in PACU, managing all the issues in PACU is very helpful. Um, and I think, I have a good relationship with our PACU nurses, and I think part of building that relationship was, showing interest in their opinion on what I could change.
Yeah. Yeah. No, I wholeheartedly agree with you. I mean, you know me, I'm always trying to learn from everyone also, right? Whether it's nursing staff, PACU nurses, anesthesia. I mean, I've come up to you multiple times asking you, oh, what gases do you guys use for this? When do you guys think of, I mean, it's just in a sense, right? The more that you learn, the better you are as a physician. And I don't think I'm ever good enough to not learn from anyone, right? And I think if you have that perspective, you're going to build good bonds, good connections, and of course, make residency that much more easier for yourself. So
I think there'll always be a special relationship between ENT and anesthesia, the two airway people.
100%, 100%, 100%. All right. So talk to me kind of what is, a story or a situation, kind of what is the most stressful or annoying thing that you ever had to deal with in residency, if you can come up with one.
Um, Gotta think about it.
So
Most
you're good.
stressful. I mean, I would say the most stressed I've felt during residency is your first night alone, when you're on
Yeah.
call at night alone. Even though you're not actually alone, it feels like it that first time. Um, and if if you have a less hands-on attending and a big trauma comes in, you're, you know, you're not on your own, but you really feel like, oh man, it's up to me.
Yeah.
Um, in those situations, it's very helpful to, and that's why it's important to have good relationships with the rest of the staff. You need to lean on people. Ask your anesthesia techs, hey, can you run the Belmont for me? Ask your senior to come over from OB or whatever to help you. That's probably the most stressful part that I can think of. And then the first day of any new, especially CA 1 year, you like finally feel like you're getting the hang of it, and then they throw you into, now you're on peds month, now you're on neuro. now you're on XYZ, you're on labor and delivery. So the first week of all those is pretty stressful because you're trying to, get your feet wet. Um, and then CA2 year, the heart month can be stressful for a number of factors.
Yeah,
Yeah, I mean, overall, I've had a really good experience. I've never really felt that there was an undue amount of stress at any point.
sure. So I guess on a diving a little bit deeper here, let's say it's your first night alone, like you said, right? And huge trauma comes in. You're an anesthesia resident first time. Work me through kind of mentally how you process that. On a step by step process. What are you thinking? How are you going through those motions? Right. This is your first time, right? And all of us at one point in time have felt this, right? And so it's not just you, of course, but how did you kind of work through that, right?
Well, I think the most important thing to make um, to make your life easier in those scenarios is good preparation. So at the beginning of the night, make sure the trauma room is set up with everything you could possibly want. It's a teaching institution, so it's okay if you drop some drugs you don't end up using. Um, it's better to be prepared. And as you get, further along, you get more cost efficient and stuff like that. But don't worry about that at first. Having everything set up the way you want, where you're not scrambling to program the Alaris pump for Levophed or, you know, fill up your anesthetic gas because it was empty. All those little things make a huge difference. The one of the hardest things with anesthesia specifically is you do your medical school and intern year, and you never really, you know, learn how to spike an IV bag, even something simple as that. How
Yeah.
to program the Alaris pumps, all this new equipment that is either normally like nursing does it on the floor, or it's specific anesthesia stuff that you never learned about in med school. So if you can learn before your first night alone, if you can learn how to use all that equipment, um, that makes a big difference because then you're not having to stop everything to ask somebody something like that. Um, Not worrying about the chart, you can always go back and chart, um, is another thing. I think people can get stuck on, oh, I need to make sure the vitals are pulling in the chart because it's such a pain to go back and do it, but the patient's the most important thing.
Yeah.
Um, and then just, leaning on the staff, like I said, having the anesthesia techs around the Belmont, making sure your attending is in there, calling a senior if they're available to come help you, or even if it's like a CRNA in OB, call them. They'll come help you. They've been doing it longer than you too. Um, do you want to know like specific stuff for anesthesia? That's kind of just general.
Yeah, I mean, I think the general stuff is pretty good. I mean, without obviously, I mean, even on the more specific you get into, I know there's a long list, of course, but I think you hit on the high notes. I mean,
Yeah, I mean,
same thing, like, you know,
like this isn't like super. This is anesthesia stuff, but like, remember your ABCs, airway, breathing, circulation. Like, most important
yeah,
thing when you get in the room, airway, IV access, all the normal stuff you would want to have in a bad situation, because really all you need to do anesthesia is an airway and an IV. That's all you need. Um, so when they come in, if you don't have time to hear what lines they have in the ER, or if they're already intubated or not. Just have all your stuff set up, central line or big 16s on both sides. Like, you know, you you can save yourself a lot of headache by having a good airway and good IVs.
for sure, and kind of picking back on a little bit of kind of what you said before is, asking for help is such a key thing, especially when you're starting out. Never strand yourself because you're going to get into the shithole, right? If you're by yourself, you think you know something, but you don't. It's your first night on call, right? And so, just really being humble and being like, hey, like, it's my first night, asking for help. And, even I mean, even now, like, I'm almost done with residency, but I get consults on a bad airway, and I ask everyone to be there, right? Even though majority of time it's gonna go fine, right? But usually anesthesia's there, RT's there, right? And usually it's like a really bad head and neck cancer that anesthesia is like, oh, I can't get an airway. And if I have to do a slash trach bedside, things like that, right? But you never want to be the one, right, that you look back and you're like, oh, why am I the only one in this room, right? That's never a great, right, experience. And so I always say load the boat, regardless of, if it's your first day or your last day, right? Because more help is always good. But yeah, for sure.
I think it's even more important to load the boat the further you get along because you start to feel like, Billy Badass and like, oh, I can take care of this. And then all of a sudden you can't take care of it and you didn't call
Yeah,
for help because you got a little cocky.
for sure,
It's
man. For sure.
it's easy to get overconfident the further you
Yeah,
get along.
for sure.
I mean, we're all
For
guilty of
sure.
it.
Yeah, yeah, for sure. And that's something that, I every time that something acute's happening, and like you said, there's as you get better and better, right, you're always thinking that, this should go fine, but it's really not for the times that it goes fine, right? It's that time, that 1% chance that something off the wall happens. You don't want to be stranded. So definitely, for sure, just always staying humble, because some of my attendings will always say, like, especially in surgery, even if some of the simplest surgeries can humble you, right? Even some tonsils where you're like, yeah, majority of times takes 5 to 7 minutes, right? And then you have a really bad one that takes you 30, 40 minutes, and you're like, man, that was not fun, right? So anything can change on a dime. And so, as keeping yourself humble, for sure, to prevent yourself from digging yourself in a really deep hole by yourself.
Yeah, it's the same thing with anesthesia. You'll get on a really good roll. You've popped in 40 epidurals in a row, first stick, and then all of a sudden, oh, I just wet tapped two people in a row, or I can't get the saline, or whatever.
Yeah,
Whenever you start feeling good is when something like that happens.
for sure, for sure. Medicine is super humbling, for sure. But on another note here, let's talk about malignant attendings. Do you have any in general? And then if so, how do you mentally handle these tough people to work with? Because, we all have these kind of people that we work with, regardless of specialty, but I'm curious about your experience.
Well, I've been lucky in that the vast majority of our attendings are a pleasure to work with. Um, I think every program will have one or two. Um, any
For sure.
specialty, any program, you're going to have that. The biggest thing is just don't take anything personally, and that I think that's good life advice in general. I don't always take my own advice. I think everybody is taking things personally from time to time. It's easier to take things personally when it's the middle of the night and you're tired and stressed out, and maybe something bad happened with the patient, whatever. Um, but you'll save yourself a lot of headache and heartache if you just let it roll off you. I mean, I think everybody now is extremely sensitive about everything. It's very annoying. But if if you, I mean, because a lot of times if you have an attending like that, they're trying to get a reaction out of you. So
100%.
so if you deny them that, they probably won't mess with you again. Or if they do, you've already let it roll off you once. It's easier to do it again. Now,
100%.
that being said, continue to be respectful. Just be the bigger man, I guess, is the saying. But if you do your job and you're respectful and you don't fire back, there is nothing bad that can happen to you other than getting your feelings hurt and sticks and stones. Um, in fact, most of the time, if there's something egregious, said to you or whatever, and like I said, this has almost never happened to me, but assuming you have a good, program director, whoever's in charge of this stuff, you can communicate what happened, and usually, something can change. Um, I mean, that's
Yeah.
really it. It just boils down to just don't take it personally.
Yeah, no, I mean, um, we all have one or two, right? Doesn't matter what specialty. I'll agree with what you say. It gives you thick skin, of course. Um, and yeah, and you know, probably similar experience with you, right? But surgical subspecialty, of course, we tend to get those. Um, but yeah, for sure. I mean, these people, if you react, they'll keep doing it because that is what
Exactly.
gets
Yeah.
them off, right?
Yep.
That's really what drives them to be who they are. And it's such a weird thing, right? I'm not somebody like that as a person. So I never like understood it, but I just knew that that's how they are as a person. So yeah, you have to just, not take it personally, right? Kind of
And
let things go. Yeah.
even on that note, try try not to attribute malice if there's any other explanation. So like even if somebody's being a dick to you, it is still possible that they're doing that to help you, to toughen you up, you know? So
Yeah.
it may not even be that it gets them off, it still might be that to some degree, or it might be that to 100%, but
Yeah.
I think some of them do it to make you a better doctor, to toughen you up.
For sure, for sure. I think there's a combination for sure. Do I think days where they're just being a dick to be a dick? 100%, right?
Yeah,
But
of course, of
like
course.
you said, don't automatically think that, because I do agree with what you say. Where a lot of the generation now is, maybe this is a hot take, but a lot of people are very sensitive. Um, and I think it's also by experience too, being through residency. And if you've dealt with enough malignant attendings, then you can kind of be like, there's scales to this thing, right? But of course, understanding that sometimes in some situation it is to get you thicker skin. It is to prepare you for very stressful situations, right? Especially in surgery, right, where we have to deal with that, especially in acute settings. Um, but regardless of the situation, try to kind of reflect, think what you can learn from that situation, and of course not take it personally, because if not, then if you carry that, it's going to in a sense, right, linger for such a long time, and it's not anything beneficial for sure. So
Yeah, I mean and then when you are like after the situations happen, you're reflecting, you know, I usually try to wait a day before I really think about it, because if you're thinking about it while you're angry, you're gonna miss the things that you can improve on yourself, because there might have been a very valid reason that they were being a dick to you if you were doing something wrong, and you're not gonna realize it while you're pissed off. Um, so
yeah,
I try to never fire off an email, about anything that happened until at least a day later. Just, calm down.
yeah,
You
I think
might
that's
you
it.
might have been in the wrong.
Yeah, yeah. No, for sure, for sure. I think that's a great advice. Sometimes in the moment it's very, very difficult, especially since, in a sense, when you're a resident, we're all old enough to feel like we're professionals at that point, right? And so no one likes it when they're getting, especially, I mean, it's probably the same for anesthesia. A lot of the times we're getting reprimanded or yelled at or whatever. It's very public, right? None
It's
of
in
this
front of
is
the whole
usually.
OR, yeah.
Yeah, so that's the difference when you're dealing with OR, right? A lot of like your quote unquote hard lessons, right, are in front of people, and that's never a good feeling, because you know that whatever lesson you're being taught, it's usually specific to your specialty, right? Whether it's ENT, whether it's anesthesia, and people around you, especially that don't know. Like for me, right? If you got yelled at in the OR and I'm next to you, right? A lot of times I'm going to be like, I don't know what gases he's talking about. I don't know, right? And so we don't have context, and so it always feels really bad when scrub techs are looking at you and they're like, oh man, Daniel must be an idiot, right? And the context is not complete. So always in the moment, kind of relaxing a little bit, think about it later, because always in that moment it's kind of difficult to
Yeah,
to
because you're
think clearly.
embarrassed. Because you're
Yeah,
embarrassed,
for
yeah,
sure.
because it's in front of people. But like, I mean, that's another thing. Like what you said, you're thinking, oh, the scrub tech thinks I'm an idiot. Well, that's at the end of the day, that's your projection about what you think they're thinking.
Yeah,
And
for sure.
if you actually ask them, they'll probably say, "Oh, I've seen way, way worse chew outs, and like you're fine, like it's not a big deal." And
Yeah.
but in your head, you're thinking, "Oh my God, everybody thinks I'm stupid,"
Yep. For sure, for
when
sure.
it's not
And
true in
definitely,
reality.
yeah, yeah, for sure. And I'm glad that you mentioned that, because yeah, sometimes after these things, right, when you've cooled down, like nurses or anesthesia or scrub techs will come up to you and be like, hey, like this is nothing, right? Like don't worry about it. But in your head it's so much worse, so
It's always worse
for
in
sure.
your own head than what is actually happening.
Exactly. All right, let's change gears a little bit here on a lighter note here. So, talk to me about kind of the work-life balance of anesthesia residency. How is that like? Do you feel as though you have enough time outside the hospital to do the things that you do? I know we touched on it a little bit at the beginning.
Well, I can only speak for my program, but I've been very pleased with um, our residency in general, and then also specifically the work-life balance. And this isn't a residency interview, so I'm not just saying that.
Yeah, yeah,
It's really good. You work a little bit more your CA 1 year. Um, it's really it's really not that much more in terms of hours CA 1 year. It's more that you're just exhausted because it's all new stuff all the time. So you come home from work tired even on a regular day because it's just new stuff, and you're really having to use your brain a lot, and that's thinking is tiring. Um, I noticed towards the end of CA 1 year when things kind of started to click. All of a sudden, when I came home from work, I wasn't tired, and I was like, oh, okay. And then so it makes CA 2 year feel really good because you are working a little bit less. You have one less call a month. Um, your weekends is one less night. Um, so overall, less hours, less nights, and you're not tired from a regular work day most of the time. Um, so it feels a lot better. And then CA 3 years, kind of even more in that direction.
sure.
You can have some additional stressors with, job application, fellowship application, all that kind of stuff. But overall, it kind of peaks CA 1 year and then gets a lot better. But even CA 1 year, I never came close to 80 hours. I never felt like I was, uh, didn't have enough time to take care of my, you know, ADLs. um, had time to exercise, had time to play video
Yeah,
games, had time to study.
gotcha.
Um, yeah, I mean, and like I said, that's just one program, but
Sure.
I mean, put numbers on it, I would say CA 1 year, I probably worked, 60 to 65 hours a week. CA 2 year has been more like 55 to 60, and CA 3 years, what I've heard is like 50 to 55. Not bad at all.
Perfect. Perfect. Yeah. So at least for, the Texas Tech program for anesthesia, good work-life balance for sure. Having
Yeah.
plenty of time to do, the family stuff, friend stuff, hobby stuff, it seems like.
They're pretty good about when you're at work, putting you in good learning cases. Like aside from maybe the first month where you're just learning how to do basic stuff, they're not going to stick you in a room just doing lap choles all day. You're going to do it. The time you're there and working is high intensity, like focusing on stuff that is helpful for you, so that when you know, they don't have to keep you there for 80 hours a week for you to learn what you need to learn because you're only in stuff that's good learning opportunities for the most part. Of course, that you know, there's always sometimes staffing issues or ratios or whatever, and sometimes you will get stuck doing, but that's not that's kind of rare. That's not the norm.
Gotcha. Gotcha. All right. So hot take question here. What's your perspective and opinion on resident pay?
It's BS. I mean, what do you expect? It's funded by the government, so it's always going to suck. Um, yeah, I mean, obviously I think residents are grossly underpaid. I mean, depending on how many hours you work, it could be less than minimum wage if you actually did the math with hours. That's not the
Yeah.
case for me because, well, what is minimum wage now? I don't even know.
Actually, I
Like
don't know. Is it
$15 or
10?
something? Or is it?
15? 10 or 15, I think.
Yeah, so I mean, if you have a really heavy week, you could be a little under minimum wage, but that's I don't think that's going to change anytime soon. And that's not the program's fault. That's the government funding. It's unfortunate. I'm lucky personally because my wife works. She's a speech path, like I said earlier, so she has a good income. So I haven't really had to worry too much about money during residency. And then my program offers it's basically internal moonlighting. It's paid call that you can start taking your CA 2 year, and it's paid pretty
Cool.
well. So I think our residents do pretty well. The last 2 years of residency with income, but not everybody has that, and not everybody lives in Lubbock, Texas, where everything is cheap. Um,
Yeah, for
where
sure.
you're only filling up your gas tank once a month, and you can get a nice house for $1,200 a month, and food's cheap. Everything's cheap here. So combine that with having a wife that works and the internal moonlighting, and I've never been stressed about money during residency. But if you're in New
Yeah.
York or California and maybe you have a family, but your wife doesn't work, and you're relying on a sole income and a place with high taxes and, you know, everything's more expensive, then yeah, it can be extremely challenging. And I know there is some cost of living adjustment for resident salaries, but from what I've heard from people in other states that have higher cost of living, it's not enough.
Yeah. Yeah, for sure. What do you think the solution is for resident pay, you think?
Oh God, I don't know. I mean, I don't see it not being paid for by the government anytime soon. Um, I mean, I don't know how any of it would work, but if it was paid by the hospitals, then there might be some competition to offer better salaries to residents.
Yeah.
If some hospital or program wants, oh, like we want really, really good residents, so we're going to offer, higher. I don't know. I'm just talking out of my
Yeah,
ass,
no, no,
but
for sure. I mean, it's a very, very complex thing for sure. I mean,
I don't think it's
the
going to
reason why I'm
change
asking,
anytime soon.
yeah, it's not going to change anytime soon. And, the thing that people from the outside always say is like, oh, but they're still training, right? It's like,
Yeah,
yeah,
but
in
we do
theory,
the
yes.
majority of like we're the workhorses of the hospital. So.
Yeah, yeah. That's the thing that people don't understand, right? It's like we are learning still and we're training, right? But, you know, most people after college have a career job, right? Instead of that, we went to 4 years of medical school after that, right? And then, right, we went to residency, right? And so, we've already lost a bunch of cost benefit, right, for all the schooling that we've done. And then, you finish medical school, you get to residency, and it's a decent salary, right, on the outside. But if you talk about on a hour to hour, like, payment, right, hourly wage, right,
It's low, yeah.
it's grossly, grossly underpaid for the kind of work that we do, right, which is patient care,
Also,
which is significant.
also we're
So
still training, but the hospital still bills off of all of our work.
yeah.
So the hospitals are making money off of our work. Um, and I don't even think it's really the hospital's fault because they're not in charge of our payment. It's
Yeah, 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 no, for sure. I mean, the hospital, I mean, I might be incorrect here, but if I'm not mistaken, I know the hospital, at least for our salaries, they have some sort of payment with the government. It's a combination. It's not just full government.
yeah,
So for
yeah.
instance, like,
But
yeah, so
I
yeah,
thought maybe I'm wrong, but I thought that resident salaries were standardized across the nation, and the differences were based on cost of living adjustment and
you
inflation
know
each year.
yeah. That I agree with. No, for sure. I just don't know how, like, for instance, because our attendings and our program director always say, like, for instance, like UMC or Covenant, pays a certain X amount of your resident stipend, right? Or not resident stipend, but resident salary, right? So I don't know what the breakdown is exactly. And then of course the government, aka the School of Medicine, pays part of it too.
Yeah,
But yeah, like you said, practically residency salary is pretty standardized across the United States based off of standard of living, right? So here,
yeah.
right,
Well, that's what
you
I
try
mean. That's what I mean by like I don't think it's the hospital. Like I don't think they're like legally allowed to
to
since it's
increase.
standardized. I don't think they're allowed to be like, oh, we're going to pay our residents 100,000. I don't think they can do
Yeah,
that.
yeah, for sure. I got you. I got you. I got what you're saying. Yeah, for sure. Don't know what the solution is. I know that residents are already, in some states are allowed to unionize, which I think that will kind of push the needle a little bit. Um, But will it be anytime soon? No. It's going to be a long time before major change happens. But I do think that as, these places like New York and California that you talk about, that they unionize because, I mean, it's unlivable sometimes, right? Like
Yeah.
they cannot live with a family, right? And so, depending on kind of how much change they happen, it'll probably trickle down to places, at the very end, like Lubbock, right? Where, cost of living is not that high. People are not making waves about payment, etc. But depending on kind of what those states do, I think eventually there might be some change.
Yeah,
So
I mean, I think if resident salaries are increased anywhere, they'll have to do it for everybody because
yeah,
there'd be absolute uproar if like some states residents were getting paid twice as much. I don't think
for sure.
I don't think like the national organizations like the ASA and ACGME and stuff, I don't think they would let that. Like I think they would make it so it's for everybody. I would
Yeah,
hope anyway. I don't know. I don't have a lot of
yeah,
faith in
yeah,
I don't have a lot of faith in
yeah.
bureaucracy.
Yeah, no, for sure, for sure. Takes forever to change, for sure. So let's talk on a lighter note here. So, you're getting done with residency. Talk to me kind of about job hunting, interviews, things like that.
Yeah, well, so I'm interested in staying in Lubbock. So there's really only two places to work, and I'm heavily leaning towards UMC to staying. Where
Gotcha.
at my program, I've like I said, I've had a very very good experience, and I'm very interested in staying there. I just interviewed last week. Um,
Awesome. Well, congratulations, man. That's a huge step.
yeah, it's I'm really excited about it, and you know I haven't. Oh, I think one of my headphones just died. Can you hear me? Okay.
Yeah, I can hear you.
Okay.
Okay.
Um, yeah, I mean I haven't officially signed yet, so uh,
Well, good.
but
Yeah. Well, good luck to you,
I'm
man.
planning on it.
Yeah, yeah, I gotcha. Well, good luck to you. Well, talk to me kind of what are you looking forward to most, being done with residency and things like that. What's the thing you're looking forward to most?
I think having a more predictable schedule. Um, every place is set up different, how the call schedule works and stuff, but um, I like that I have more control over my schedule, and of course, money. Everybody's looking forward to making attending salary. Um,
Yeah.
on, yeah, so I would say more time for my family and my hobbies. We want to start having kids, getting a house. Kind of like putting down roots because it's kind of hard when you're a resident. Like, if you are renting a house and you maybe are applying to fellowships, you don't know where you're going to be, so you can't. It's hard to like put down roots, and I think it feels really
Yeah.
good to kind of take away the uncertainty and be like, okay, I'm going to be here for a long time. I'm going to live well. I can get a house. I can have kids. I can put down roots. It's a really like
Yeah.
what's the word? It's a content feeling, you know. So
Gotcha.
really the uncertainty is what I'm excited to not have anymore. Um, and I'd be lying if I wasn't excited to get some toys that I've always wanted.
Yeah, no, no, I got you, man. No, I mean,
But on that note, everybody's heard the advice, but don't go blow a money bunch of don't go blow a bunch of money your first year out. Pay off your student loans. Be responsible.
no, 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 for sure, for sure. I mean, that's a big thing, and you're talking from making an okay salary in residency to sometimes 5 to 10x depending on kind of what specialty you're on. So definitely for sure making sure that you're financially sound, not buying tons and tons of cars and houses and being in a massive amount of debt. So all that is super important for sure.
I mean, I
um
think a good way to look at that is you have tiers of things you want, right? So, like for me, I like to hunt. So, there's some guns that I've always wanted to get that are like nice guns. Okay. Well, the difference in cost between a nice gun and a nice car is massive. A nice gun, a few $1,000s. A nice car, $80,000. So,
yeah,
that it's okay to treat yourself when you finish, but just pick stuff in the lower tiers of things that you've always wanted. Where like, yeah, in residency, a few $1,000s for a nice rifle is way too much. Like I'm not going to do it. But when you're an attending, you can say, okay, I'm going to treat myself with that, and it doesn't put a dent in anything. Whereas if you went out and bought an $80,000 car and signed a mortgage, well, you know, that's more significant. So
for
you
sure.
can still get that dopamine hit that you've been waiting for the last 10 years without being irresponsible.
For sure, for sure, and I think with our long track, definitely for sure. On a more happy note, definitely for sure. Treat yourself, right? You deserve it from all your hard work. Whether it's for you, it's for hunting, right? Whether it's in the future a car, whether it's whatever it is, as long as it's within your means, definitely for sure. Treat yourself because our route that we take is long, right? 4 years of medical school, and then anywhere from 3 to 7 years, sometimes even longer, depending on kind of what you do, right? And so when you finally do reach that finish line, it's okay to splurge a little bit for sure.
And what people don't think about is like if you start making money straight out of college at 22 years old, okay, we'll say a resident on average is maybe 31, 32 before they start really making money. So that's 10 years of retirement accounts, investment accounts, all that stuff that you would have started putting money into, and it's accruing compound interest, right? So um, that's one thing. Whatever you can put away during med school and residency in retirement accounts or investment or whatever, do it, because that will go a long way. And then when you get out, your first few years, put a lot aside to put into those accounts because you're playing catch up to the rest of the population.
Yep.
You know,
Yep.
somebody else has had 10 years to build up their retirement account. Well, you got to catch up.
For sure. For sure. Great sound advice. So I got only one more question for you since, we're running out of time here. But, if you were to give one huge piece of advice to medical students trying to match into anesthesia, what would that be?
It's hard because it's gotten a lot harder since I got in, even just in 3 years. Um, I mean, I think now you kind of have to treat anesthesia like ortho or ENT or derm or any of those traditionally very competitive ones, early interest, research, now that step one's pass fail, unfortunately, you have less of a way to differentiate yourself. So I guess step two, um, you just got, I mean, like any other really competitive ones, you have to do anything you can to separate yourself from the herd. I mean, I, I, I don't think I'm allowed to say how many applications we got for our program, but it's 4 spots and we got an insane amount of applications.
Yeah.
Um, yeah, I think treat it like any very competitive specialty, and make sure you actually want to do it. I mean, um, it's the same with any specialty. You sort of get an idea when you're a med student, but I don't think you really like know until you're in it. So get as much exposure to it as you can. I think our program does a pretty good job of having med students sit in the ORs for the whole case with the resident, and that gives them a good opportunity to see what it's actually like. Because anybody can hop from room to room, intubate some people, and then go chill out, but you got to make sure that you actually want to sit in that room the whole time, and deal with
Yeah.
the less exciting things. So
Yeah. No, for sure. Great advice. Well, I appreciate your time on the podcast, Kel. I for sure learned a ton, and I hope a lot learned from this too. So,
yeah, I hope so. I've
yeah,
never
for
done this
sure. Well,
before,
let's. Yeah, no, for sure. I think it'll help a lot of people. But hopefully in the future we get to do this again. And kind of until next time, I'm Beyond Scrubs. I'll catch you later, man.
All right, take it easy.